Hi class, welcome to the chapter takeaway for chapter 1, titled What is Public Health? In this video, I'll briefly be going over some of the topics covered in chapter 1, and you'll also find a similar video to this one for each chapter where I just briefly go over the chapter. Even though you view this video, I do expect you to go through the chapter PowerPoints that are provided to you in the module, as well as some information from the chapter section found in the second content page of each weekly module. And of course, you are required to read the chapter as well in order to make sure you prepare yourself for the quizzes that are assigned in this course. So let's get started. So I'm going to remove myself from the screen and continue on talking about chapter 1. So what is public health? So I'm just going to give you a little example of a morning routine. And I know many of you know what public health is, but just so we have this clear idea. You wake up in the morning, you get out of bed, you go to the bathroom, you use the toilet, you wash your hands, you brush your teeth, you floss your teeth, you drink water, maybe you go get a workout in, take a shower. Once you get ready, you're going to go have some breakfast. You open your refrigerator, get some yogurt or something to eat. And it's whatever you're getting out of the refrigerator has been preserved, right? Due to being in a refrigerated or cooled environment. The truth is, all these things that we take for granted are there due to the achievements, or they reflect, I should say, the achievements of public health. You enter your car, you get your seatbelt on, your car has an airbag. There's all these things that we take for granted and that are there to help us stay healthy and have been put in place due to public health. You know, we take for granted that the water we drink is chlorinated, that we're advised to wash our hands all the time, that indoor plumbing eliminates the transmission of common bacterial diseases, which, if we go back centuries, killed the young and the not so young. So this kind of gives you a gist of what public health is. And in many cases, you'll ask the general public, what is public health? And a lot of times, the first thing that comes out of their mouths is health care for the poor, which is true. Public health has always been about providing services for vulnerable populations or those at higher than average risk of disease or bad outcomes. Public health approaches to vulnerable populations range from reducing exposure to lead paint in deteriorating buildings, to food supplementation, to preventing birth defects. Even addressing the needs of vulnerable populations has always been really a cornerstone of public health. So this leads us to what is public health? And public health is the science and art of preventing disease, prolonging life, and promoting health through an organized effort. And the substance of public health is the organized community efforts aimed at the prevention of disease and promotion of health. Now, these two definitions that I just provided to you really show how the concept of public health hasn't changed much. However, there were some very important changes, or I should say, at the moment, public health is undergoing important changes. An example of this is the goal of prolonging life. It's being complemented by an emphasis on the quality of life. Protection of health when it already exists is becoming a focus, along with promoting health when it is at risk. The use of technologies like the internet. It's really redefining the definition of a community. There's also been an enormous expansion in the options for interventions, as well as increasing awareness of potential harms and costs of intervention programs. So now we are focusing more on evidence-based public health. We also have public health and clinical care, as well as public and private partnerships, are also coming together in ways to produce collaborative efforts rarely seen in the 1900s. Also, public health is increasingly paying more attention to the full range of health issues, not just prevention among mothers and children, say, or the working aged population, but prevention of disability among our growing elderly. So a full life cycle approach is in the process of going under the umbrella of what public health is. So let me continue here and briefly go over the chapter overview of what is included in this chapter. So we have the brief history of public health, images and definitions, as I just kind of went through that a little bit with you, what public health is as a system, its unique features, and the value of public health. All right, so let's go to the slide that covers the brief history of public health. And these are looking at the early influences. First, ancient cultures perceived illness as the manifestation of supernatural forces. So this is kind of the phenomena that was accepted regarding diseases like the plague, leprosy, cholera. Then we look at when the Age of Reason or the era of enlightenment came along between 1685 through 1815, where these accepted realities of these supernatural forces being the cause of such illnesses were challenged. These theories were challenged. And then we jump into kind of the transition between imperialism and industrialization. So the stage was set for epidemic diseases. Populations shifted to urban centers where the focus was more on commerce and industry, which led to public health conditions worsening regarding epidemics like yellow fever, tuberculosis, smallpox. And we had the Board of Health that was kind of formed, where it's kind of the earliest organized response to these epidemics. And then we're going to go into some of those first public health pioneers that really kind of paved the way of some of the big achievements that we have seen in public health. So one of the first here is Edward Jenner back in the 1700s. He was actually recognized that cowpox, a common mild ailment among those who milked cows, protected those who developed it against life-threatening smallpox. So he was actually able to develop a vaccine that was derived from the Latin word vacca, or cow, and he actually placed this fluid from cowpox sores under the skin of recipients, including his son, and then exposed them to smallpox. Now, despite the success of these smallpox prevention efforts, widespread use of the vaccination was slow to develop, partially because at the time there was not an adequate scientific basis to explain the reason the use of this cowpox vaccine, I should say, it's a smallpox vaccine, which was derived from cowpox, had a protective factor. And then we have John Snow. So So coming into the early and mid 1800s, really the awareness of public health began to emerge in the US and in Europe. The US public health movement had its origins in Europe, where concepts of disease as the consequence of social conditions took root in the 1830s and 1940s. This movement, which put forth the idea that disease emerges from social conditions of inequality, kind of brought the concept of social justice about. Many attribute public health's focus on vulnerable populations to this tradition. So while early organized public health efforts paid special attention to vulnerable members of society, they also focused on the hazards that affected everyone. An example of this is the contamination of the environment. So this focus on sanitation and public health was often called hygiene movement. Now, despite the absence of an adequate scientific foundation, the hygiene movement made major strides in controlling communicable diseases, again, like tuberculosis or waterborne diseases. And this brings us to John Snow. Now, John Snow is often called the father of epidemiology. He helped establish the importance of careful data collection and documentation of rates of disease before and after an intervention in order to be able to evaluate its effectiveness. And he's known for his efforts to close down the Broad Street pump because the water being supplied was contaminated by cholera to a district of London. His actions quickly helped terminate the epidemic, and his approach has become a symbol of the earliest forms of epidemiological thinking. And then last, we have Edwin Chadwick, which we're looking back at 1842. He was actually the official leader of the sanitary movement of the later half of the 19th century. And he actually wrote an inquiry into the sanitary conditions of the laboring population of Great Britain. Now I'm going to jump to slide 7, quickly going over the eras in the US public health. So we're looking at prior to 1850. We are looking at battling epidemics. Then 1850 all the way to about 1949, we're looking at building the state and local public health infrastructure. And then 1950 to 1999 really had a lot to do with filling gaps in medical care delivery. And then 1999 on is really when we focused on preparing for and responding to community health threats. So now I'm going to be jumping into the 10 essential public health services, or also known as the core functions of the public health service. And then I'll be ending the chapter takeaway video. All right, so here we are with this diagram here, kind of highlighting the essential public health services. So we have monitor health status to identify community health problems. Then we have the diagnose and investigate. So the aim here is to diagnose and investigate health problems and health hazards in the community. 3 is to inform, educate, and empower individuals and communities about health issues. The 4th one is mobilize community partnerships. And this is important in order to identify and solve health problems. Then developing policies and plans that support individual and community health efforts. Enforcing laws and regulations that protect health and ensure safety. Here we have link to or provide care to needed personal health services and assure the provision of health care when otherwise unavailable. Assure competent workforce. So you really want to assure a competent public and personal healthcare workforce. And then ultimately evaluate effectiveness, accessibility, and quality of personal and population-based health service. And then last is research. And this is really to get the new insights and innovative solutions to health problems. So public health agencies exist on the state, federal, and local levels. The types of responsibilities and authority differ significantly by state. However, at each level of government, the public health agency is responsible for the following essential services. 1, to prevent epidemics and the spread of disease. 2, to protect against environmental hazards. To prevent injuries. To promote and encourage health behaviors. To respond to disasters and assist communities in recovery. And last, to ensure the quality and accessibility of the health service. So I just wanted to touch on some of the topics covered in chapter 1. Make sure to read the full chapter and go over the key public health frameworks, the social ecological model. These are some of the topics I did not go over in this video. And as always, if you have any questions at all, do not hesitate to reach out to me. All right, everyone, take care. Bye.